Hello, we are the University of Calgary 2024 BIOMOD team, a multidisciplinary group focused on using the molecules of life and bio-nanotechnology to solve real-world problems. There's an evident rise in neurodegenerative disorders such as Alzheimer's disease, Parkinson's, ischemic stroke, and development of early dementia and depression, all of which are associated with damage to the blood-brain barrier through tight junction disruption and results in a loss of normal brain function. According to the Alzheimer's Society, 6.3 million people in Canada will develop, live with, and/or ultimately die with dementia between 2020 and 2050. Therefore, the problem we aim to address is the lack of preventative healthcare for early diagnosis, specifically in the case of neurovascular damage. In fact, delaying dementia onset by even 1 year could avoid nearly 500,000 cases of dementia in Canada by 2050. Of note is that 70% of Americans have expressed an interest in knowing early if they have Alzheimer's, granted that it allows for earlier treatment. Early diagnosis matters because it allows individuals to access treatment at a stage where it will be the most effective. It also allows people to make informed choices, seek support, and establish plans. This grants them further autonomy when neurodegeneration takes away from what people value most: their memories, their connections, and ultimately, their independence. The current diagnostic solutions include MRI and CT scans, which, because of their year-long wait lists, actually discourage people from seeking a diagnosis. Secondly, there are blood and urine tests, which couple technology like ELISA immunoassays to detect disease biomarkers. However, it does not have the resolution to detect the low quantities of biomarkers present in early disease stages. Lastly, there is no gold standard for diagnosing the most prevalent of the blood-brain barrier damaging disorders like Alzheimer's, as each test varies in selectivity, sensitivity, and its calibration. Therefore, there's a need to develop technology that minimizes wait times for patients and clinicians, offers high resolution, specificity, and selectivity to accurately find biomarkers and link them to their respective diseases. Here, we present DNADetect, a nanoscale two-component biosensor which, through its innovative use of an RNA aptamer and DNA origami, can detect blood-brain barrier damage and the potential diseases associated with it. By innovatively exploiting the advantages only offered at the nanoscale, such as efficient sensor and target interactions for improved sensitivity, improved resolution through higher capture efficiency, and an improved signal-to-noise ratio, we're able to overcome the obstacles experienced by current tech and streamline the diagnosis process. The feasibility of the design comes from its use of RNA and DNA, which are affordable and have highly predictable structures and interactions. This allows us to scale the sensor to detect various disease biomarkers at once. Our sensor is twofold. Firstly, we designed an aptamer that will only bind to broken disulfide bonds present on occludin proteins, which indicates that the blood-brain barrier has been breached. Upon binding, the ribozyme will cleave the aptamer and produce a fluorescent output. Secondly, for selectivity, we will be using DNA origami as a scaffold for a molecular channel termed nanopore. These will use size selection and electrical conductance recordings associated with each biomolecule once they pass through to differentiate and detect various pathological biomolecules. Right now, we are conducting a human factors analysis jointly with the Faculty of Nursing and the Faculty of Social Work at UCalgary to ensure that our sensor meets ethical guidelines and addresses the concerns that our end users, such as clinicians and nurses, may have early on in the design process. Our next steps would be to model our nanopore and aptazyme, then actualize the design in lab and troubleshoot for stability and sensitivity. This is followed up with blood-brain barrier simulated testing and nanopore functionalization. This project meets the UN Sustainable Development Goal 3 of good health and well-being, as it streamlines the diagnostic process, ensures early detection of neurovascular diseases, and promotes timely access to healthcare resources. This also enables proactive healthcare, as optimizing biosensor design enhances diagnostic efficiency, allowing for proactive intervention and improved overall health outcomes. Sustainability Goal 10 of reducing inequalities is addressed by offering an affordable solution with the aim to reduce economic disparities in healthcare by providing an affordable and multifaceted diagnostic solution. By streamlining the diagnostic process, we contribute to a more equitable healthcare system that ensures that diagnostic resources are available to a wider population. Sustainability Goal 12 of responsible consumption and production is met through efficient resource utilization, with the aim to reduce the need for creating and running multiple diagnostic tests to ensure responsible consumption of resources. By avoiding the duplication of diagnostic tests, DNADetect contributes to reducing medical waste associated with repeated procedures. The streamlined diagnostic process by DNADetect will allow clinicians to advise and administer the right treatment early on to their patients and provide them the option to make informed choices about their health, overall empowering and improving healthcare experience for clinicians, patients, and families.